what's it like to go through spinal decompression therapy with the DRX 9000. Oddly enough, I'm actually the patient as well. I've been dealing with back pain since I was about 15 years old. I have been on the DRX numerous times over the last 18 years since we've had the machine. I think it's been about maybe 15 years since I've had an MRI on my back, so I'm really curious to see what's going on. Before, I had some degenerative disc disease at L4, I had some degenerative disc disease at L5 with an annular tear and a small disc herniation at the very last disc, which is L5, but I've never had any nerve root compression. I've never had pain radiating down my leg. So I'm really curious to see what's going on with my back, and we're gonna find out.
So it's talking in the MRI description about how important a real physical examination is and how few times we actually hear about physicians doing a proper neurological exam. And so we can actually tell so much from just an exam. Sometimes we can pinpoint the exact nerve root that's pinched if patients have specific symptoms. Like in my case, I knew that, from the numbness and tingling in my big toe, that it was the L5 nerve root. Now, of course, I didn't know exactly where in the spine it was pinched. I knew it was either behind the L4 disc or exiting at the L5 disc. That's why we need MRI imaging to further assess exactly where the problem is, but at least from a proper examination, we really know what to look for in the MRI. So it gives us a huge advantage over, say, just the radiologist who just is looking at some pictures. He doesn't have the background, he doesn't have the history on the patient, he didn't examine the patient. Whereas when we look at your MRI, and since we're trained in MRI imaging and diagnostic radiology, we know exactly where to look so that we can find subtle changes sometimes that, gosh, how many times have you read an MRI that the radiologist read incorrectly? Frequently. All the time, yeah. All the time. I mean, probably, let's say 10 to 15% of the time, minimum, that we pick up things that were missed from the radiologist. So a proper evaluation is key. So Dr. Robbins is going to demonstrate on me what a proper eval looks like. So
we're going to start with reflexes first.
So what's interesting though is a lot of people have had this done since they were a kid and have no idea why doctors do reflexes. So reflexes tell us that there is a proper communication between the tendon when we tap on it, that sends a signal to your brain, and then your brain sends a signal back down the spinal cord to the muscle, and the muscle reacts. It lets us know that there's a proper loop, a closed loop, that there's no break or a kink in the loop. So when we have a ruptured disc sometimes that's pinching a nerve, it's literally decreasing the signal down the nerve, and we will have a loss of reflex where we tap and nothing happens. That's a very bad sign. Of course, most people wouldn't know how to check your reflexes on their own at home, but that's why we check. And I mean, how many times do these patients get reflexes at their doctor? Like hardly ever.
I had a patient doing one time just last week. I've never had my ankle reflexes done, just my knee reflexes and back blood. Only test a nerve root.
So this tests the L4 nerve, this tests the S1 nerve. There isn't a reflex for L5, but we do have the big toe to test for L5. So if your doctors aren't having you take your shoes off for a spine exam, that's also bad. So at a minimum, we'd have you take your shoes off so that we can assess the strength of the big toe. I do this on every single patient, every single time for every evaluation. So I'm a little bit scared, and I haven't been evaluated yet. I already know that my left ankle dorsiflexor, that's the muscles that hold the ankle lifted, are a little bit weak because I'm having a little bit of a hard time keeping my left foot elevated when I walk on my heels. So I already know there's a little bit of weakness. We haven't tested my big toe yet, so let's see what happens.
Big cut.
So that's good. You can't push it down.
Oh, dude, that's super weak.
Oh, I'm trying. Oh, wow, super bad. Yeah. So that's bad. So that's not a good sign. So nerve root is very pinched. It means that the motor portion of the nerve is compressed, and the motor portion of the nerve is not getting the signal from my brain to keep the muscle elevated. So that's a very, very bad sign.
It's not a physiological weakness, it's a neurological weakness.
That's right. Yeah. So exactly. It's not because I haven't been working on my big toe. It's because neurologically it's literally not functioning.
So that's a bad sign. So
My feet up like this one too.
I'm very saddened to see this. So not bad. Not bad.
Push out against me. Better. Pull back. Perfect.
Right, and then so the other test would be what we'd consider like orthopedic test, and
Push my foot straight up for me. And that. And that one.
right there. So I want you to know, like, patients present all different ways. You all saw my MRI earlier. It's a bad disc herniation. Clearly, it doesn't look like I'm in a lot of pain, and I'm not. But I can't straighten it any more than that.
What if you bring that toe up? Oh yeah, it hurts. It hurts more.
Yeah, and so what I feel is just like intense stretching, like pulling. And for somebody who didn't know, who wasn't a healthcare provider, they might just think they were ultra tight in their muscle, which is how a lot of chronic sciatica, that's how it presents. Like, oh, my hamstring, it just is so tight on the inside, it just never lets go. That's a sign of potentially chronic sciatica. In my case, it's nerve tension, it's nerve root tension. It's literally, there's so much pressure on the nerve root that when I'm trying to straighten the nerve, it's tugging the nerve, it's dragging it against the herniation. So
Yeah, so when you lift your leg, the nerve moves with the leg. So if there's something in the way and you lift the leg, you're just dragging that nerve right against that disc herniation.
yeah, precisely. All right, and then the other big test would be a lying straight leg raise test.
So just relax the leg. Pretty normal.
Yep. So cool.
And the bodies are bettering the cuff.
Yeah, and so that's accentuating the stretch on the nerve. Yeah, and so that was what, about 30 degrees? Yeah, so that's about 30 degrees, which clearly is nothing like my right side. And then the only other stuff would be like range of motion, palpating the spine. So we would typically, just kind of pretty tender. The right side has nothing, no pain at all. Left side is not too bad there, a little higher on the left.
Yeah,
Right there, yeah, across there. And then in my glute on the left side, yeah, right in there, that's really painful. Yeah. Big time. Nah. And then we would just chest simple things like range of motion. So this is hard for me because it's stretching the nerve. And so that's about all I can go before it really is pulling on my left leg bad. Leaning back's fine. Side to side's fine. Like facet loading, I've got a little bit of discomfort, kind of twisting just to the left side, but
so heel walk.
heel walk.
Triceps on your heels.
Yeah, I can, yeah. But it's a little bit weak here. It's coming down a little bit. Yeah. So it could be a lot worse. So I could have severe low back pain. I could have worse pain on my leg. But the real key is that neurological deficit. So this is what we're going to be watching very, very closely. Most of the time when we do treatment on the DRX, even in severe cases of neurological deficit like this, we're able to see progress really, really quick. This is not something that we would, want a patient to have a permanent neurological deficit. So if we were treating on the DRX and somebody wasn't improving, unfortunately at that point, their probably only option might be surgery. We would maybe try an epidural first before the ultimate decision was made for surgery. But, most of the time we're able to really start seeing some progress within 2 weeks. So we're going to keep a really close eye on my symptoms. And we're going to keep retesting and see how I do over the course of the next week to make sure that I'm starting to get better and I'm improving. And it'll be very obvious. It'll be one or the other. So, all right, well, we're going to go hop on the DRX now, and we're going to show you guys what it's like to get it through a full treatment on the DRX.